The governor and some Republican leaders met Friday morning. What's going to be the result of this, and what needs to come from this meeting?
I think the meeting was really to have a discussion to see if there's common ground that we can come together on. Obviously, the citizens of Wisconsin have been speaking up saying, hey, we really want you guys to get together and get something done. So I think we'll get together early next week just to have the discussion as the leaders from both the houses and then the governor had the discussion. We'll find out kind of the result of that.
The Wisconsin Hospital Association sent you a letter and other leaders this past week saying the health care crisis in the state without action will become a catastrophe, pointing to ICU patients 4 times higher than 2 months ago. They want a legislative mask mandate and more regional hospitals. Is that something you're going to do? Do you support the legislature backing and proposing a statewide mask mandate?
There's differing opinions in the legislature right now. So that's a discussion we're having as a Senate caucus. Obviously, I can't speak for the assembly, but we're having those discussions right now. Our focal point is related to the mask mandate is the ability of the governor to does he have the authority to actually issue the emergency order? That's been our concern from the beginning, is the governor doesn't have the ability to do that per the Supreme Court rulings.
In just the past week across the Midwest, Iowa's Republican governor issued a statewide mask mandate, limited indoor gatherings, closed bars at 10 o'clock. Ohio's Republican governor implemented a 21-day curfew. Why haven't Republicans in Wisconsin acted to slow the spread?
Well, if you look at what's happening right now, people understand the risk. We're talking about this a lot, and the Republicans in the legislature have had a lot of discussions as we watch the numbers. ICU beds has always been my thing. I've been very public about that. And as we see that continue to increase, we continue to talk about, and we want to say publicly, listen, number one, follow the guidelines that are out there.
Besides the health crisis, you could be facing a money crisis if Congress fails to act by the end of the year. The governor's administration said $466 million from January to April to cover CARES Act costs if Congress doesn't act for testing, hospital system surges, vaccine infrastructure. If Congress doesn't act, how much of that $466 million is the Senate Republican caucus willing to spend?
Yeah, there is definitely a concern with where's that money going to come from. So the governor put it out and said, hey, these are additional spending items that he'd like to see, but there's no funding source for that, and there's no accountability around it from the legislature side. So that's obviously a concern of ours. So we'll have to take a look at that. I think that's part of the discussion that happened on Friday, and we'll have a discussion as a caucus when we get together early next week.
What's the alternative if Congress and the state doesn't act? Does this fall on municipalities, or does testing just go away?
Well, I think that we'll have to figure out what we're going to do as a package. So remember, there's a lot of different things that we're looking at right now to help out.